Hi, my name is Frankie Borelli,
And I'm Jessica Wilson.
and we're occupational therapy students at the University of South Alabama. We have conducted the contextual memory test by Joan P. Toglia while we were performing an evaluation on a patient at an assisted living facility.
The contextual memory test was designed to assess awareness of memory capacity, strategy use, and recall with adults with memory dysfunction. It has been used with a wide variety of diagnoses, including patients with head trauma, cerebral vascular disorders, dementia, multiple sclerosis, Parkinson's disease, brain tumor, AIDS, epilepsy, chronic alcohol abuse, depression, and schizophrenia with negative symptoms. This test includes two equivalent forms which can be used to screen memory, impairment, and monitor changes in status. This test is unique and examines different aspects of individuals' knowledge of their memory limitations. It also can be used to determine the extent to which a patient is responsive to cues aimed at enhancing strategy use and recall. This information is directly related to choosing and designing a compensatory or remedial treatment program.
The contextual memory test is easy to transport and can be administered rapidly and easily. It uses pictures of related objects as the items to be remembered. The use of meaningful items as the stimuli is thought to be relate more to everyday memory function than stimuli used in traditional memory tests. The CMT is not diagnostic and is not intended to replace any other standard measures of memory. It provides information which can supplement conventional measures of memory and cognition. The CMT has been standardized on subjects without obvious memory dysfunction who are 18 years of age and older, and has been demonstrated to have reliability and validity with adults who have organic memory dysfunction. For best practice, the contextual memory test should be administered in a quiet room that is adequately illuminated and free from distraction. For standard administration, you will need the picture cards, the score booklet, a stopwatch, a pen, or a pencil. Administration of the recognition format also requires the 40 recognition cards. Patients should wear corrective lenses if they are normally required for reading or near vision.
The CMT is easily portable and requires only 5 to 10 minutes to administer, in addition to 15 to 20 minutes delay, during which time other testing activities may take place.
I'm going to ask you a few questions. Have you noticed any changes in your memory? Just say yes or no.
I can't remember anything.
How would you rate your memory capacity now in comparison to like years ago, before you started to forget things? Was it, do you think it's like your memory now is like 25% or 50% or 75 or 100? Does that make sense?
The lower it gets, the worse it is. 90% is worse.
Your memory capacity now, so the lower the number, the worse it is.
It's bad.
Bad. So like 0 or 25%?
I'd put
0 or 25.
This
is where 0 is the worst. Probably that.
Well, whatever is bad.
Okay. Okay, now, say we give you, we're going to have a picture with a lot of objects on it, and there's 20 of them, and we show it to you. How many do you think you could remember? Just a number. If we took it away, and then we said, what pictures did you see?
Well, which would be next to the worst?
Like if there's 20 objects, would you remember maybe 5 objects? Or maybe 2, or, you know what I mean? Like, if I showed you a picture and there was a bunch of different objects on there, and then I took it away, how many do you think you would remember?
What was maybe would be the maximum?
You can remember up to 20, but not so good would be like 5 or 0 or 1. Does that make sense? Just like a round number.
Yeah. Just
Like 2 maybe. Would you remember 2 pictures?
Yeah.
Okay. But before, whenever you were sharp, you had a good memory. You think you could remember a lot more?
Mm-hmm.
Maybe like 15, or before you used to forget things?
Oh, if I saw the picture,
Mm-hmm.
let's make it half.
Half? Okay, so 10. Okay. How frequently do you forget things that happened the day before? So, like yesterday. How often do you forget things that happened yesterday? Like, can you remember anything that happened yesterday?
At least
Half the time?
About half.
Okay. How frequently do you forget something like important details? 3/4 of the time, half of the time. How frequently do you forget things that people have told you?
Not much.
You remember what people tell you, or you don't remember anything? Do you forget if I tell you something, do you forget it later?
Yeah.
Yeah, most of the time?
Yeah.
Okay. How frequently do you forget things that happened like a few minutes ago? So like maybe when we walked in the room, do you forget that too?
Yeah.
Yeah, how do you think most of the time? Or maybe like half of the time? Or like 3/4 of the time?
What would you say?
Maybe 3/4 of the time?
Well, remember?
Mm-hmm. No, oh no, you don't remember.
No.
You forget. You forget it 3/4 of the time.
Right.
Okay. And would you remember facts about this form like in a week? Say, would you remember that we did this?
Yeah.
Would you remember that we did this with you?
Very little.
No, probably not. Okay. Okay. I'm going to show you some pictures of objects.
Of who?
Of objects.
Objects.
You will have 90 seconds to study them. Afterwards, I will ask you to tell me what you can remember. Let me know if you are not sure what the name of an object is. Are you ready?
Not
And you'll have to tell me what objects you remember seeing. But I'll let you look at this and you can study this for 90 seconds.
Toothpaste, toothbrush, soap, faucet, paper, on, dress, toilet.
Okay.
What is that? Towel? No.
Think of it.
What do you call that?
If you remember, just let me know. Okay.
Dresser. Dresser?
Yep. Okay. Now tell me if you can remember everything that you saw in the picture.
Toilet.
Hello, Julia.
Tub.
I'm gonna give you some fresh ice.
Shirt. Towel. Toilet. Dress. Toothpaste. Toothbrush. wow.
Really nice.
Shirt,
Okay.
shoe,
Okay.
toilet, shoe. I call it, I think I said dress.
Mhm.
Shirt, and I said shirt.
All right, Julia.
I think that was all of them.
Hand, face, foot, I guess that's it.
Okay. And now we just have a few questions to ask. How difficult was this task for you? Was it easy? Was it somewhat difficult, or was it very difficult for you?
It was. What did you say?
Well, it's whatever you think.
I
It's
can't
a
think
person-
anything.
What's a personal opinion? Yeah. Was it easy, somewhat difficult, or very difficult?
Difficult, I'd say.
Okay. So very difficult or somewhat difficult?
Say that again.
Very difficult or somewhat difficult?
Somewhat.
Somewhat? Okay. How do you feel your memory was on this task as compared to how you would have done before you started having memory loss? How do you feel your memory was on this task compared to how you have done before you started losing your memory? Has there been no change, a minimal change, a moderate change, or a big change compared to how you would have done in the past?
I guess it's difficult.
Okay. Do you think a moderate change?
Yes.
Okay.
Or a great change.
Big change, you think?
I don't know. What would you say about what I gave you?
Well, you got something.
Several of them
Mm-hmm.
that.
Think moderate?
Say the best.
Okay. Approximately how much did you remember? Do you think you remembered more than 3/4 of what you saw?
Half.
Half? Okay. Okay. Estimate the number of objects that you remembered. How many do you think you remembered?
I don't remember. I don't know. Half?
Half of them? How many do you think, number-wise? Do you think you remembered 2, 4, 6, 8,
Say 6, didn't
6? Okay. When you were studying the information, when you were looking at the pictures, what did you do to try to help you remember? How did you help yourself remember them? Did you group them together in your mind? Or did you visualize? Do you remember through visualizing what you saw?
I? I'll bet you I saw.
Visually? Can you explain, like, how did you visually, how?
How?
Mm-hmm.
I'm thinking.
By thinking? Okay.
Thinking I'm re-seeing it.
Did it help you, like, remember where you saw it on the paper?
Boy, this is difficult.
Mm-hmm.